This program is a paid commercial announcement and in no way represents the views of WPHT or its management.
Talk Radio 1210 WPHT, WPHT HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly FANTASIA, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning and welcome to the show. Always nice to have your company for the next hour here on our program called Health Watch, as we do our best to give you information to help you and your family improve your overall quality of life. We call that our mission statement, and we do that each and every week at the top of the show. Health Watch is all about Dr. Molly FANTASIA, the PhD doctor, as you heard the man say, and the executive director and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We'll talk about the who, what, when, where, why, and how of Innovative Medical with Dr. Molly. And, of course, we welcome your participation anytime during the course of the show. 855-839-1210 is our number here, 855-839-1210. No matter what the time of year, no matter what the day, it's always a good day to get healthy, right,
Hey,
Dr.
John,
Molly?
it sure is. How are you, John?
Good. We're just celebrating another day of
COVID. Yeah, I know.
That's
I hear
right.
you.
Let's talk about Innovative Medical, and I'm going to get into a story with you a little bit later on, and we'll have plenty of stories. But the emphasis of what you do is pretty much on the natural, right?
Correct.
The nutraceuticals.
Nutraceuticals, minerals, things that are naturally occurring.
And as opposed to, we're in a prescription world.
Well, yeah. Now, you've heard me say this before. I'm not telling you throw your prescriptions out, but I'm telling you, why don't we use them more judiciously than just writing for them? John, we work out of a licensed primary care facility, which is my facility. And all my healthcare providers, have been appointed to my facility, and that's how we got to Innovative. We're a group of primary care providers who have really gotten together and came to this from our own journey. And what we do there is we try to mitigate people's problems by augmenting this with the natural substances, just like you said. But if you need a prescription, of course, Dr. Testa can write a prescription. If you need a prescription, Dr. Pat can write a prescription. That's not the issues at all. What we want to do is limit the side effects from those prescriptions.
And we've often talked about this, where you go to the pharmacy, you get the prescription, and they give you the pills, but then they give you a book.
Yeah, a book that tells you everything that could go wrong with these pills.
Right.
Oh, and don't forget to check the interaction between those pills and the other pills that you're taking.
That's right.
And that's a whole other gamut. And one of the things we like to do is we like to help our patients using hydration to give a therapeutic level of a particular nutraceutical, or many of them, depending on what we're doing and what we're trying to effectuate the change, and allowing those things to work synergistically to help you get through your challenge.
And you just mentioned hydration. We should mention that what you do, your cornerstone, is delivering these nutraceuticals via hydration.
Right on. And right now that's been very hot because it also has been used for all kinds of issues, including delivering of traditional drugs, as you know.
Yes.
And it's an interesting thing. People have finally caught on that the way to deliver the natural products can really help a patient if delivered medically sound through hydration.
And why is that? Why is hydration medically sound?
Because it can really deliver an appropriate dose for the problem that you have without going through the digestive tract, without losing some of the viability of the particular nutraceutical.
So it's like going directly into your bloodstream.
Exactly. It's the difference between taking I-95 straight through, right? Or going to Aramingo Avenue and going all around to get where you're going.
Which is not good.
No, it takes longer, doesn't it?
Exactly,
it takes longer.
Right.
So
yeah.
maybe.
So that's kind of the philosophy of hydration. delivering the nutraceuticals that way.
Exactly.
As opposed to maybe going to a health food store.
Yeah, there's lots of good health food stores there, and there's lots of good health food products. And believe me, we know when we see a good health food product, we know the brands that work. We know what we don't want to see in them that sort of clouds up the actual potentiation of the health food product. So we look at all of those things, and from there, we help a patient. We're not going to tell you don't take your nutraceuticals. We may indeed prescribe some nutraceuticals.
Right.
So the question is to augment what we do in the bags.
Does it work? That's always the question that people give you.
John, the only thing I can say is somebody should come into the clinic and speak to my patients, right? Does it work? It certainly has worked for Dr. Molly, and from my experience, it works if delivered appropriately in the appropriate amount for a patient. Again, nothing is written in stone where we say, okay, does the drug work for you? Same thing. Okay, doc puts you on a drug, and guess what? Your blood sugar's still high. Why is that?
Obviously it didn't work. Yeah.
Right, so he's got to switch it up. Same thing is true with nutraceuticals. In other words, just because we know one nutraceutical has a propensity to help, let's say, lower your blood sugar, it may be the way you take it may not be appropriate, and that's true for the drugs as well. So the idea is delivering it IV tends to deliver an appropriate dose, gets the job done a little quicker, and then eliminates the patient from having additional problems with their pharmacy products. So
it's kind of a process that you follow.
Oh, yeah.
And it's if you're on a medication, you may not necessarily, your docs may not say go off that.
No, the docs will make that call as we move on, and we run the blood work, etc. For example, sometimes we find that we're able to help people with pain, and we can get them off of some of these neuro drugs that people put them on. We can also help with blood sugar, and we're able to help people. The other thing is we find that people do well in our program because we take the time to go through their nutraceuticals too, and we eliminate some of the stuff that's extraneous. You know how many people come into me with bags and bags of health food store?
We've talked about this all the time. Yeah,
not just their medications, not truly their pharmaceuticals, but the health food store products, and we're able to eliminate that maybe down to 3, 4, 5 and do the job for someone.
And it's like people come into you and they went to the health food store. I'm going to take one out of aisle 1, one out of aisle 2, one out of aisle 3. Yeah. And then they kind of go through it and they have bags.
Right.
And one doesn't really help the other.
How about how wonderful, God is wonderful. He can combine some products together and they can synergistically work and as a result potentiate the effect of, let's say, the primary product.
Right.
That's what's wonderful about what we do.
Is it a good idea to just go into the health food store and say, I heard Dr. Molly talking on the radio about this and this.
Alpha-lipoic acid. Yeah.
Is it a good idea to do that?
Well, here's the deal. There are some people behind that counter that really know what they're doing. Lots of them are nutritionally related fields, but some are just clerks. Hey, listen, that's like going into the pharmacy and asking the gal who's stacking the shelf, hey, does this medication really work? How do you know? She's in a white coat, right?
Exactly.
You don't know. So her opinion, it says, oh, no, why don't you try this? No, come on. We really got to look at things the way they are. And you want some advice. You definitely want some advice with your nutraceuticals because regardless, remember what Hippocrates said, let your food be your medicine. So when you think about natural products in the medicinal sense, which is something I do every day, then you want to use your experts, which are in my clinic, to help you figure out what's what.
Just because it's natural doesn't mean it can work for you. That's the other thing.
And just because it's natural doesn't mean it may not have a side effect on some of your traditional pharmaceuticals. You really got to know what you're doing.
Best to get advice.
Exactly.
All right, we're coming up on our first break of the morning. Our show is called Health Watch, and we are here every Sunday from 8 till 9 here on Talk Radio 1210, WPHT. Dr. Molly Fantasia is here. She is the PhD doctor and the executive director and the founder of Innovative Medical Associates located in Marlton, New Jersey. Dr. Molly is here and happy to talk to you if you have a medical challenge or you have a question. 855-839-1210 is the number. 855-839-1210 is our number here in the studio. And we always tell you early is a good time to call because typically at the end of the show we run out of time. We can't take all your calls. So if you want to call in, early is a good time. 855-839-1210. With Dr. Molly Fantasia, I'm your host, John DeMasi. We return. More of today's Health Watch after these words. And we're back here on Health Watch. Operators, as always, during the show, standing by at Innovative Medical Associates. 856-489-0505 is the number. 856-489-0505. When you call, you want some more information, or if you want to sit down and make an appointment with Dr. Molly, the initial consultation is complimentary. That's all you do is just call that number, 856-489-0505. They'll be there during the course of the show, and well after we leave you at 9 this morning, they'll be there all day, as a matter of fact. They're not on the beach today. No, they're working, all right? Also, the website, innovativemedicalassociates.com, innovativemedicalassociates.com. You can go there as well, get a lot of good information, and a lot of updates happen during the course of the week. So if you saw it last week and you see it again this week, it's different, okay? So innovativemedicalassociates.com is the website, and don't forget, our show is replayed, our Health Watch replay every Sunday, 4 to 5, here on Talk Radio 1210 WPHT. Our show is Health Watch every Sunday, 8 till 9, right here, Talk Radio 1210 WPHT. Let's talk to Mike in Philadelphia. Mike, good morning. You're on with Dr. Molly.
Hi, Mike. How are you?
Good morning, Dr. Molly, and thank you for taking my call.
No problem, sir.
I'm good, thank you. I got a question about prostate cancer.
Prostate, okay.
And what is accurate test? What kind of tests you recommended for?
Oh, well, first of all, help me, Mike.
Experience.
Okay, help me out, will you? Did you do your PSA, and is it elevated, the prostate antigen?
Yes, I do.
Okay.
And that's what I don't like, is if he's got any different test.
Well,
because,
there are... Go ahead, sir.
Let me say, I do have the PS test, and my score is 9.3.
Oh, that's high. That's high.
And
Yeah.
the doctor tell me this probably is cancer, and she is right.
All right. How old are you, Mike?
I'm 74.
Okay, so you're young.
74.
Right. You're not old. That's not old. Okay. Did he rule? Did you went to a urologist or to your primary doctor?
Urologist.
Urologist. Good. So
Yes.
did a prostate exam? Did he do a needle biopsy or anything?
Yes, that's what I like to tell you.
Yes.
It's 9.3. This was score, and she did the biopsy.
Good.
And from 12 sample, I find it 2 and cancer it.
Okay. So how are they treating it right now?
And that was back in the 1 year. And the time she recommended me that chemo and radiation.
Okay. Well,
And we did chemo and radiation. And
You
6
did do
months after this, I do a second blood
Round.
test, and my result
PSA.
is 1.2.
okay, so it's come down. That's excellent. Listen, what you
It's
should
coming
do is,
down, but
still it's a little high.
See what's
high.
happening.
Right, it's
This
still
before,
high.
Before
Yes.
before was 9.3, and from a 12 sample find it 2 cancer.
Okay.
Now the second time is 1.2,
Right.
and from all 12 is cancer, and
Right.
4 of them is not stage 4.
Okay.
Aggressive cancer.
Okay. All right.
So I
listen.
don't trust this test anymore.
Okay, I can understand
Because
that.
it is 9.3 and only 2 cancer. And
I see.
second one is 1.2 and it's all 12 cancer.
Okay. Well, listen to me, Mike. Here's
So
the
these
thing.
got
I'd
any
love.
different test.
Yes, I would love to see the results, and I would love to see the results of the particular biopsy. I'm sure my doctor would like to see the biopsy results as well. And I can tell you this: I have several patients who are your age, by the way, who are taking our anti-cancer supportive treatments, and I can tell you that they're tending to do very well. The thing that worries me is that the prostate number is still not down to where it should be. As you know, it should be somewhere between 0 and point something, not 1 point something. So I really want to look at that, and I would want to repeat that test and possibly do a couple other cancer markers. But fundamentally, I want to look and have my doctors confer with me, but there are many things that we are doing to help patients, including the use, by the way, of vitamin C, but some other things with that in the IV. If you call my office and come in for the free consult, bring everything you have with you. Please, I think we can help you.
Mike, good luck with that, and thanks for the
Please.
call. We appreciate
Thank you.
it.
That's a
Appreciate it.
very interesting call, John, because, again, the PSA is not back to normal. It's my experience in looking at this along with my good doctors that we see usually after the chemo and the radiation, it goes down to what would be a normal value. So I'm very interested in this case.
Yes. Okay.
Thank
Mike, good luck with that.
Thank
and feel
you,
free
Mike.
to call.
God bless
Eric
you.
is in Exton, PA. Eric,
Hi,
good morning.
Eric.
You're on with Dr. Molly.
Hi,
Hi,
Eric.
Doctor. Thanks for taking my call.
No problem.
I've been listening to you off and on for, I guess, a number of years. I'm health-oriented.
Thank you. Thank you, sir.
I'm probably one of those people that would come walking in with a bag of
I'd love it.
vitamins and all that.
But you're
70
health-oriented. You're health-oriented. You know exactly what you're taking. Okay, go ahead.
Exactly.
I like it.
77 years old, and my wife has got dementia. She's in a facility right now.
Oh, I'm sorry to hear that.
Yeah, but while I've been cooped up here and trying to do things, I've been taking webinars on the internet and basically been introduced via that to functional medicine.
Yep.
Great. I mean, it's all all free, and it's just opened my eyes, and it's like, oh,
it's
gosh.
unbelievable. Yeah.
And all of the toxins and things, it's like it's scary.
It's very scary. It's very scary. I'm with you 100%, and I would say that's what we are, of course, is a functional medical facility. Because, again, if you think about it, what's the disease process is one issue, but quality of life is also important. Very important. No matter what the disease process is, we want you to have the highest quality of life you can while effectuating the change for your challenge. So, yeah, I think you're on the right track.
Well, that's, because of my wife, that's how I got into this. She was also healthy. She exercised and took vitamins and all of that stuff, but and cooked right, or at least we thought we were. But go ahead.
May I ask a question about your wife? Any genetic issues with that? Did anyone else in her family have like a dementia or a potentiation towards Alzheimer's disease?
Yes.
Okay.
Don't know what they were. She's been diagnosed with FTD, but diagnosed is kind of like observing. I don't know that it was clinically diagnosed.
I understand.
And her both her mother and her father had some difficulties.
Well, since I can talk to you. You know that just because we have a genetic propensity for a particular condition, we do not have to let those genes rule our life. We can do some things to mitigate that. I'm not saying that absolutely if you do everything you've done, it will stop this, but it can certainly keep you going for quite a while. So, I think you're on the right track. Tell me a little bit about your vitamin regime, sir.
Oh, well, I take a pretty hefty multivitamin with a bunch of antioxidant stuff on it, and she goes through, it takes some Q10, PQQ.
Good.
I've been, I don't know if I can mention the brand or not. There's one brand that I've been kind of getting through the mail.
Well, you can mention it. You can mention that to me off the air, and I'll happily tell you if it's one of the brands I also get through the mail. So, yeah.
Well, see, that's the thing is there's so many things out there you're not quite sure. I mean,
exactly.
This webinar stuff of they interview a whole mess of doctors and you get a whole mess of different opinions and most they're all on the same track, but it's amazing how even they will say don't do this or do this or whatever. So.
Sure, yeah. and that's the joke in our clinic. 3 doctors, 4 opinions, but the real deal is. You want to look at brands that really have been around a while, that have the clinical data to support them. We're very big on that. And we want to look at the brands that have the constituents that we know effectuate the changes that we're looking for. So our process is a little different. One of the things I'm very, very on top of dementia and memory and those kinds of things. Because it's a terrible condition to be fully functionally viable in terms of your physiology and lose your thinking process. So I'm big on that because I myself I'm 72. So believe me, I'm in your ballpark. I don't want John and I both we laugh about it, but we don't want to have any problems with that.
That's right.
But I think you're on the right track. I will tell you again. One of the things I don't do is sell vitamins in our clinic. Indeed, if we think people need to be on some natural or foods, etc., we will tell them where to order these through the mail, that kind of thing. We do have some of that product in stock because I may want someone to start something right away.
Right.
But I'm very selective, Eric. So I think you're right to be selective. I love webinars. I love, places on the internet that you can go and get information, but I want us to take all that information with a grain of salt. And as I aptly told one of my physicians just the other day, we didn't get the only functional medicine book that was ever written out there. Okay, it's really important to research and continue to research because there are new developments every day, both conventionally and in terms of the nutraceuticals, as I said earlier, about the synergies of them. So believe me, I think you're on the right track. I'd love to chat with you on the free consult.
Eric,
sometime.
Thanks a lot. Thanks for the call and good luck with everything.
God bless you, Eric.
Your input. Sounds like you're doing a good job.
He is. He's a good guy. Thanks, Eric.
All right. Coming up on a break here, our show is Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, and she is the PhD doctor, executive director, and founder of Innovative Medical Associates in Marlton, New Jersey. And, of course, I'm your host, John DeMasi. We're happy to talk to you. Some calls already. 855-839-1210 is our number here in the studio, 855-839-1210. We'll come back with more of today's version of Health Watch after these words. And we're back here on Health Watch. Don't forget, operators standing by right now at Innovative Medical Associates. 856-489-0505 is the number. 856-489-0505. You want to call and make an appointment with Dr. Molly? Remember, the initial consultation is complimentary. That's all you do is call and schedule it. And you can get a lot of your questions answered at that point. 856-489-0505. Operators are there now. They'll be there well after we leave you at 9 o'clock. And you can call them anytime during the course of the day. And, of course, that's the number during the week as well. 856-489-0505 is the number. Innovative Medical Associates, Marlton, New Jersey. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. A lot of good information on that. And we also want to remind you that if you miss any of our show this morning, we have our Health Watch replay. It's today's show this afternoon from 4 to 5. Here on Talk Radio 1210 WPHT. By the way, people have tried to call the 4 o'clock show.
Yeah, I know.
It's a replay.
That's right.
So
That's right.
we're not live there, just so you'll understand. If you want to call, you call now during the course of the show. Speaking of calls, let's go to the phones. Craig's in Philadelphia. Craig, good morning. You're on with Dr. Molly.
Hi, Craig.
Hey, morning, Doc. I was going off of a site, Danielle Sittel, Sittel, on Google. In her WordPress, she says, pay attention to every word. She's caught in a human trafficking ring under Epstein in his forced marriage with her captors. I'm being isolated. Is that okay?
Yeah, we don't know what this is all about, Craig, and thanks a lot for the call.
Is it? Yeah, I'm a little confused here.
Whatever.
Okay.
Whatever.
Good.
I wanted to talk about something, and this is significant because I wanted to bring out something that happened to me this week, and it just clearly points out. I've known you. We've worked together for 20 years.
That's right.
And I'm having a back problem, and you sent me to one of the premier systems in Philadelphia.
Sure.
Went there, and the doctor examined me, got an X-ray, and said, well, I'm going to put you on a medication.
Imagine that.
You're laughing because I remember, we've done so many shows, and people say, how do you remember? Something sticks in your head when you've said something, and the medication, I can mention it, right? It was called,
wouldn't.
No?
I wouldn't if I were you.
Okay, well, whatever. So I said to myself, the medication sounds familiar, and the prescription was for 300 milligrams.
Right, it was pretty high.
Now, I know enough to know that that's pretty high.
It's a sizable amount.
And so the next day was my day to come in your office, and I showed it to you.
And we chatted
about it, and you went, whoa, no.
Well,
so explain,
sure. Here's the deal, John. First of all, I sent you to somebody at this facility because we wanted to get, what do I talk about? We want to get the diagnosis. Before we say something about the meds, we want to get the diagnosis. So the expert made the diagnosis based on the X-ray, but you notice she's still sending you in for an MRI.
Yes, correct.
Okay?
Correct.
And you're getting that done this week. It would be interesting because I bet you anything she could have waited a week before putting you on that meds. And in the meantime, you're talking to us and my docs, and you say that you're having this lower back pain, something you hadn't mentioned before, okay, other than when I sent you over there last week. The bottom line is this. That medication works on nerves, neuro. It works in the neuro, and it's a pretty heavy-duty med. And we've had a lot of patients who've come in with a lot of side effects. A lot of these neuromeds and that work on nerves and nerve endings tend to have lots of trouble. The other thing is I'm very concerned because you have some comorbidities, as you know, one of which is the diabetes, which then contributes sometimes to this neuropathic pain. So one of the things I want to do is I want to change up your recipe, give you some homeopathics if the FDA continues to allow me to get them. Look at the homeopathics, start you on those kinds of things, and work with you with a patient of mine who is a chiropractor, as well as possibly send you to a pain management specialist who's in my network, not just outside. But I want to get the results. I want to get those MRI results and the X-ray results so that we know what we are truly dealing with. If you have to go on a medication, okay, let's let the pain guy prescribe that, not necessarily who I sent you to in the.
Yeah, but the thing is here, I knew something was not.
Yeah, this
right.
med's been around, and it does cause a lot of side effects.
Yeah, and actually, the doc in question here said to me, this might make you a little sleepy.
A little sleepy.
I love the way they phrase things.
It might make you a lot sleepy, and you do a lot of driving, right?
Yes.
You're a 60-mile-a-day guy, one way.
Right.
So that's a lot of driving. So the bottom line is we want to be careful and utilize some things that may help your problem without having these side effects. And I think, John, look, when you need a med, you need a med. But there are other meds possibly in that category, but I want a pain guy to talk about that.
And we kind of have a course of action. We're waiting for the MRI.
Of course we do. But in the interim period, I'm going to change up your IV therapies now to really concentrate on this, and I'm also having you come in an extra day a week.
Exactly.
Right.
So I guess this is a good, and I wanted to bring it up because it's a good point of how if I didn't know you or if I didn't know any better, I mean, I would have gone on this medication. I'd be walking around like a zombie probably.
Correct. And in your line of work, I don't think that's a good idea.
No, not at all.
And you know what? I see a lot of patients who are on this. And remember, again, I'm going to talk about, most people who come in to see us are not just on one med. You're not.
No.
Okay?
No.
And we've cut those meds down. I mean, we've cut your cholesterol med down. We've cut a lot of blood pressure med down. The idea is you don't want to take a new med and put your system into another overload. Now, if you need a med, trust me, after we get all the information and you go to the specialist we send you to, you need a med, you can be sure our doctors will prescribe it. But probably in an amount that's more appropriate, understanding what additional things we do for you through the IV.
300 milligrams is a lot, isn't it?
Yeah, but it depends on the med too,
Yeah.
right? But still, for you, the way you react to medication. Listen, John, you had a surgery, as I recollect.
Yes.
And they couldn't get you up from the anesthesia so quickly. Do you
Yes,
remember that?
I remember that,
I
yeah.
remember it well. So you have a very sensitive type of body. You're biochemically sensitive. So for you, we want to be extra sure that dosing of the med, even if the med itself is appropriate, that's the right dose for you.
Okay. Coming up on our final break of the morning, we still have time for some questions. If you want to talk to Dr. Molly, 855-839-1210 is the number here, 855-839-1210. The show is Health Watch every Sunday, our live version, 8 till 9. Here on Talk Radio 1210 WPHT. With Dr. Molly Fantasia, I'm your host, John DeMasi. We return. More of today's Health Watch after these words. Welcome back to Health Watch. Operators standing by right now, and after we leave you at 9, they'll be there. The number is 856-489-0505. That's 856-489-0505. When you call, if you want more information, they'll be happy to provide that for you. And if you want to sit down with Dr. Molly and go over your particular issues and situations, well, that's the best thing you can do is make an appointment. A little hard for her to really get delving into things in depth here on the show, but in the office, in the privacy of the initial consultation, that's where you do it. 856-489-0505, Innovative Medical Associates, Marlton, New Jersey. The website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. A lot of good information on that as well. And also, we should remind you, if you missed any of the show this morning, or you say, you know what, I heard something, I'm not sure what I heard, you want to hear it again? We replay the show today, every Sunday, the Health Watch replay from 4 till 5, right here on Talk Radio 1210 WPHT. Our show is Health Watch, of course, our live version right now, and our number here, we have time for one or two more quick calls. If you have a question for Dr. Molly, 855-839-1210, 855-839-1210. And Dr. Molly, new patient this week. I know you wanted to talk about this.
Oh, he's a great guy.
A lot of patients with diabetes, myself included.
Yeah.
So,
and we've been handling and hopefully improving the quality of life of our diabetic patients for many years. But it's interesting because this gentleman's married to a nurse. He's a very, very smart guy. Interesting, though. We reviewed his blood work and we saw that his hemoglobin A1C, and hemoglobin A1C is a 3-month indicator of how well you're controlling your blood sugar. But his was way out of whack. And it's interesting because he's doing everything right. So obviously something happened metabolically. And in chatting with him, it seemed like he went through a whole lot of challenges in his business. He has a very successful business, and as a result, he just has some problems that, I think caused him to have a challenge in terms of metabolically. But what we are doing is we're treating him with alpha lipoic acid. We're treating him with several things that we think can help. But the reason why I like this case is he was not so quick to sign up. His wife's a nurse. He went back home. I told him research a little bit more. It goes to the point that I always say, nobody pulls you right into the chair, right?
That's right.
You come in, you talk. And he called me several times after the consult, and I did get on the phone because I enjoyed chatting with him. He's a smart guy. The thing I think we have to do is Barbara has to get in this, my nurse, who's going to sit down, go through all of his nutraceuticals, because we think there are some things in there that may have fillers that are actually causing some of his problems. And we also want to revamp that and make sure that everything we're giving him is exactly what is needed. So that being said, he's got a great case, and I think he's going to start to see definitely a change in about the first 10 to 15 treatments. John, I want to say that diabetes is not something we take lightly. You don't have a touch of it. If you have it,
you got it or you don't. It's
right,
like being half pregnant.
Right.
No, you're either or you aren't.
Don't let people tell you it's just a touch of sugar. A touch of sugar can be very, very deadly for a patient. And by that I mean, if you look at the sugar molecule, look at the glucose molecule, it's big, and you look at your red blood cells, and that's pushing the darn thing up the hill. And believe me, people have problems. You know that. They have problems with their extremities, they have problems with their blood pressure, etc. So our job is to try to help him get this diabetes under control. And with a little change in his diet and some changes in the oral supplements and continuing to take our diabetic protocol, I think he'll be back on track.
So the prognosis is what, 10 treatments at least to start with?
At least. He's probably going to need 30 because he's had this for quite a while and he had a heck of a year.
Yeah. And being in business, this is a challenge this year.
Very big challenge for all of us, right? A very big challenge. So that's one of the cases that I had this year. And of course, I have my cancer patients. And I had a very interesting conversation because one of my CLL, chronic lymphatic leukemia patients had a spike in his numbers, went into the hospital, and they're starting him on a new drug. And of course, what happens is that, people get very nervous. They're starting him on a new drug. And when I heard about it, I asked the name of the drug and I wanted to look it up, and I did. And the point is, I got my docs together and I said, look at everything that can affect this particular enzyme that they're looking to do on this guy. So we reviewed it. I really looked at it, and I now have a new game plan out for him so that anything I give a cancer patient doesn't interfere with their regime.
Is that similar to what I was talking about with my story, where the medication comes into play?
Oh, sure.
And it's very strong, and it may not be
in
appropriate?
That case, no. Well, listen, I will not ever tell someone don't do what their oncologist tells them to do, because that's their life that they're talking about, and they have to feel good about that. What I'm saying is we review the record and we make sure that anything we put in his bag doesn't interfere with the mechanism of that drug.
With your cancer patients,
Yes.
I know you have multiple cancer patients
Right.
and multiple challenges.
Sure.
But what have you found that works best in terms of helping them navigate this whole challenge?
Well, I think what works best for them navigating the whole challenge is to sit down with a team like we have, and somebody becomes the point person in the nutraceuticals. Vitamin C seems to be a universal, but again, you've got to look at how are you using the vitamin C in the extract, because again, sometimes when they create the free radicals, which a lot of the chemo drugs do, you don't want to give them an antioxidant. You want to use vitamin C as a pro-oxidant in that case, and it may mean a difference in the extract and the dosing.
We've talked about vitamin C a lot.
I love vitamin C.
It seems to come up in just about everything.
I feel like it's God's best medicine. Vitamin C is God's medicine, right? It's God's ingredients, and it's one of the best things, and it's so viable. It's so available to people. The idea is you want to use it properly, you want to use the extract properly, and you want to know where that therapeutic dose is. That's always the key, John.
And when you're talking about your cancer patients, you've often talked about 10, 15, 20 treatments.
Hey,
is it the kind of thing where you just continue to go?
You may have to go on for at least 30 to 40 treatments. It really depends on where you are in your cancer continuum and what it is we want to accomplish. I got to tell you, I have a pastor, Pastor Matt. He's doing so great. He's finished up his chemo. I said to him, well, how you doing, Pastor? He goes, I'm doing fine, but I'll be seeing you every week. Don't worry, because I'm not doing anything. I said,
Right.
I got you.
Yeah.
Okay.
So it kind of becomes, I guess you want to come in as often as you can.
Right, without being strained on yourself. The bottom line is, look, John, I'm all about we do things in an orderly manner, and we do things that are appropriate for an individual patient. You know that. That's what separates us from a spa.
Yeah. I'm happy to be coming in now twice a week.
Yeah, I'm sorry to say.
That's all right. But look, you got to do what you got to do, right?
I do, John,
Yeah.
and I really want to get this under control for you right away.
And we'll keep everybody posted
Oh,
on,
yeah,
on my
no
progress.
problem.
Okay.
No problem.
Believe it or not, time flies when you're having fun, huh?
That's good.
That's going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by right now at Innovative Medical, and they'll be there. You know, when we're off the air, they'll be there. So feel free to call them after 9 o'clock, 856-489-0505, 856-489-0505. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, you missed some of our show this morning. It replays this afternoon, Health Watch replay, 4 till 5, right here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, Dee, our nurses, Jess, Michelle, Crystal, can't forget fabulous Franny, and our medical assistant, Kathy, I'm your host, John DeMasi. Thanks for listening. Have yourself a great week and a healthy one. We'll do it all over again next Sunday, Health Watch, 8 till 9, Talk Radio 1210, WPHT. You take care.